Good afternoon, ladies and gentlemen. If we can all take our seats, please. So once again, welcome to the Loins Eye Hospital. And it's been a wonderful global service week. And this time you can be showcased the hospital and what happens at the end of some of the journeys that you've been through. So without much ado, I'd like to call upon our chairman to give you a welcome address.
Good afternoon, everyone. Is it a very nice day? Are you all enjoying? Thank you. Our international president, Brian Sheehan, and his gracious lady, we are really delighted to have you with us. Our chairman of the LCIF Trust, Douglas Alexander, again, we're very, very happy that you found time to be with us. We really appreciate that. DG Dan Elkins, and our line guests from Delaware and from everywhere else, our district governor, Sazan Luhar, our past international director, Dr. Manoj Shah, the pilot and the driver, you've seen what he is. All other dignitaries, line leaders, members from around the world. It is indeed my privilege and an honor to welcome you to this beautiful Friday afternoon to the Lions Eye Hospital, a flagship project of the District 411A and a temple of service, celebrating its silver jubilee. As I stand here, I'm most grateful to our international president, Brian Sheehan, our past international director, Dr. Manoj Shah, our district governor, Dan Elkins, and our very own generous governor, Shazan Luhar, for conceiving this plan and bringing together the lines of District 22D and 411A and so many from others from around the world to celebrate this Lions Global Service Week together in Kenya. This is a superb way in showcasing our motto of we serve. By participating in almost 30 different engagements and touching the lives of so many people, all living with different challenges. I would like to appreciate the unwavering support of the LCIF chairperson, Lion Douglas Alexander, to this hospital. We are proud to showcase this spectacular facility to you. We started with a very small clinic and single operating room. Today, on average, the hospital treats over 400 patients every day, walking through, besides the many camps that we continue. So we'll be touching the lives of more than 2,000 people every day. Here we are dedicated to achieving the excellence across our eye health clinical services, education, rehabilitation, and sight enhancement services. Eye bank and rural community outreach, some of which you have seen in the field. Our staff is very compassionate and always available and ready to help any person that comes along. Our international president's motto, we can, and we rise to the occasion of serving the needy and challenged people of Kenya. Once again, I say Karibu Sana to you all, and we share the journey for rural patients suffering from cataracts, and which is a small remain of a core service at this hospital, and so many others are happening here. Blindness prevention program is the major activity of this hospital. I hope that you will all be touched by the journey of 100 cataract surgeries that we are about to showcase to you. And thank you all. God bless you. Enjoy your time with us. Thank you.
Thank you, Chairman. We will now be showing you a showcase of the journey of 100 cataracts as it starts from this hospital each week, twice a week, twice a day, twice in a week. journey of 100 cataract surgeries, giving the gift of sight to the blind, began 25 years ago when the Lions Clubs International Foundation supported the Lions Clubs of Kenya District 411A to be able to develop this wonderful facility. At that point in time in Kenya, 80% of the people that were blind as a result of cataracts in their eyes, a reversible condition which would be able to return them to dignity. Today, 25 years later, we are proud to say that we have been able to serve 100,000 people to whom we have returned the gift of sight and given them a life of dignity where they would have been left in their rural homes with nowhere to go.
Every Monday and Thursday, a team of specialists depart our hospital and traverse different rural areas through our community outreach programs as we take all our eye care related services to the doorstep of our community at a radius of 300 kilometers from Nairobi in collaboration with local community leaders and service groups. The events unfold starting with pre-counseling sessions where we counsel community members on the services we are offering as we share previous success stories of our outreach camps.
Ni kitu rahisi sana, hata huwezi ukajua hapi kama umemalizika au bado. Ni kazi mzuri, kama mimi zamani sikuwa ninaona. Sasa hii safari ni ya pili ile nimepasuliwa, lakini macho yangu yote ni sawa. Mimi sikuwa nikiona ile mlima, na sasa naona kama paka usiku. Kwa hivyo watu wajue ni kazi mzuri hawa watu wanafanya.
We then offer patient registration with support from our camp sponsors and local volunteers.
So the purpose of this eye screening is to detect some common preventable eye conditions, to advise and to refer some cases to our allowance. Today, there are some cases which I've been able to see. We have been able to see cataracts. So basically, cataract is an opacity in the lens.
We later transport selected patients to the hospital where they are admitted and accommodated fully up to 4 days for eye operation.
Naona kama nikisaidika kwa kutibiwa nitaweza sasa kufanya kazi yangu vizuri. Kama ni kusoma nitasoma vizuri, sababu sana na huwa napenda kusoma gazeti au kitabu yoyote au Bible.
Eye operations take place on Tuesdays and Fridays, and the patients receive free medications for 3 days, discharged on the 4th day and transported back to where they were picked from. Our post-operation care ensures the patients are reviewed every morning and given medications to last 30 days.
Baada ya kupona nitakuwa na faida nyingi, sababu sitasugua watoto yangu, kila mtoto atafanya kazi yake. Wale wanaenda wana
Tumecheka. Be with us as the journey continues. Thank you all. We will now be going into the theater because it's very difficult for us to have it done in front of everyone. So we will have a live streaming here for you. And we're just reverting into theater now.
Yeah, we are just getting ready for the patient to be prepared. In the next 1 minute, we should be good to go.
She's cooperative.
So we want to welcome you all, our international president, and all the excellencies and dignitaries who are around. We welcome you to the live show as we perform the live cataract surgery in our institution. You realize that these are patients that the institution goes several miles away to get them from the field, so that they can be able to benefit from the cataract surgery that we do for them for free. And we are happy that the Lions Club International Foundation has come in a big way to make sure that the patients get quality cataract surgery, so that they can actually be able to proceed with their duties at home. So we have a full team here in theater, and we're just getting ready to just show you how we go about it in terms of having to prepare the patients for theater and how the procedure goes on from the first step to the last step. So I'll be explaining the steps as we go through. For those ones who have questions, maybe they can be able to ask the questions later on, and we can actually be able to explain. As I said, we have a full theater team led by our theater nurse Anderina, and our lead doctor is Dr. Lopa, who is going to perform the surgery in the next few minutes. So we urge you guys to relax and watch as we do what we do best. And we are happy that we've been able to serve the patients. You've given us an opportunity to serve these patients in the capacity. So currently, the nurse is preparing the patient, what we call the draping, just to be ready for the surgery. And once the assistant nurse has already draped the patient, we should be able to pick up the procedure in the next few minutes. I know some of you might have watched cataract surgery being done before, so we hope that it's not going to be scary. This is a painless procedure, as you can see. So we hope that people are not going to have nightmares as they watch this video. These are routine. Things have changed. Technology has changed. Nowadays, we do it under local anesthesia, and patients don't feel any pain when we do this cataract surgery. So as I said, our lead surgeon is just getting prepared, and we should be through in the next few minutes. I'll urge you to just watch the steps. We observe all infection control measures, and that's why you can see that this is an aseptic technique as the patient is being draped, ready for the procedure. As I said, we are happy to host you dignitaries around. We are really humbled as an institution just to be able to see what we do, because you've empowered us in terms of giving us the right instruments to be able to operate on these patients. So as I said, our patient is ready, and this patient has come all the way from a place called Shaimpei, which is almost 300 kilometers away from Nairobi. And now we just about to start the procedure step by step. We'll be a bit slow just to make sure that our guests can be able to have a look at what we do. So we'll take you slowly. We won't be very fast the way we normally do it. But because of our audience, we'll be slow just to make sure that you get the procedure. That is the eye, as you can see. And now our surgeon is ready. We normally stabilize the eye by doing what we call anchoring the superior rectus muscle, just to make sure that the eye is stable during the procedure. And that is what is currently going on. We stabilize the eye, saying that the eye cannot be able to move sideways or up and about, because you realize that the eye is a delicate organ and we don't want to make mistakes. And once we've anchored the eyeball like that, the eye itself, it can actually not move from sideways, and the surgeon can actually be able to perform the procedure without any trouble. Now, after anchoring the superior rectus muscle, our surgeon is actually dissecting the conjunctiva being the outer thin layer of the eye. So he's just dissecting the conjunctiva so that we can make an entry inside the eyeball. There will be a bit of blood, so don't worry. There will be a bit of blood, but we try as much as possible to control the blood so that you can actually be able to see clearly what is going on. So now the conjunctiva that has been removed, just to make sure that we get a good entry inside the eye. Some more patients normally have a bit of anxiety because of the age, so we try as much as possible to just calm them down as we counsel them as far as the procedure is concerned. Having had a full consent when they arrive now, a surgeon has made an incision on what we call the sclera. The sclera being one of the cords of the eyeball is a bit tough, and we use that incision to gain entry into the eye. And as I said, this is a painless procedure, so we urge our audience not to get scared. The patient is under local anesthesia. As we said, technology has changed. So once we make that scale incision, we try to do what we call paracentesis, so that we can stabilize our anterior chamber, because we also don't want to get damage on the cornea as far as the eye is concerned. We use what we call viscoelastic gel, which is an inert gel, just to make sure that it stabilizes the anterior chamber and makes it deeper for us to be able to perform the cataract surgery. We are trying as much as possible to position the eye for you so that you can actually be able to watch the procedure and enjoy whatever we are doing. As I said, we are taking you through these steps step by step. We are not in a hurry, so that you can actually be able to follow. People have always said that when you are doing cataract surgery, an eye is removed and put somewhere, and then you take it again. But we have to demystify that, because that is not what normally happens. We don't remove the eye and put it again inside the socket. So as you can see, the eyeball is still intact. We've managed to get entry into the eye, and we have to make sure that we deliver the cataract and put an implant so that the patient can actually be able to smile and see tomorrow. We are trying to get a clear view so that the audience can have a clear view as far as the procedure is going on. As I said, we normally gain entry into the eye step by step because, as I said, the eye is a delicate organ. We also don't want to damage the structures that are inside as much as we want to give our clients and our patients vision that they require. That's why you'll see we keep on using that gel just to stabilize the eye and to stabilize the anterior chamber so that we don't damage the cornea. The step that is going to be done now is very critical in terms of having to do cataract surgery. We call it capsulotomy. Normally the lens has 4 layers that are important. So the doctor is trying to remove the anterior capsule just to make sure that we can be able to deliver the nucleus of the lens. That's what we call capsulotomy. It's trying to cut the anterior capsule such that now we can actually be able to get the nucleus gently. So that's one of the most important steps as far as cataract surgery is concerned. And now once we get the anterior capsule out, we can be able to deliver the nucleus of the lens gently out such that we do a nice implant. So we are trying to delineate the nucleus and we are putting it. We are actually bringing the nucleus into the anterior chamber so that we can deliver it. I know people are used to the term delivering in maternity, but here we also try as much as possible to deliver the nucleus out, not delivering the baby in maternity. Here we are doing nucleus delivery. As you can see, the doctor is getting it gently outside the eye. And as I said, that's also another important step as far as cataract surgery is concerned. Now we've removed the opaque lens, and now we should be able to wash any other remnants that are remaining inside the eye so that we can now do an implant later on. We are trying as much as possible to give you a clear view and hope you are noting down the questions later on. Maybe if we can have a session, whoever has something to ask, we'll be able to respond to that. And now we are trying as much as possible just to get the remnant lens matter inside, so that we have a clear, what we call a clear bag, where we are going to insert our anterior, our what we call a posterior chamber intraocular lens. We also use fluids that are normally the electrolyte balance for these fluids is also taken care of, because we don't just use any fluids as far as the eyes are concerned. And that's why there are 2 specific ones, what we call balanced salt solution and Riga's lactate, that we always use to maintain the osmolarity as far as the eye is concerned, because we don't want to introduce fluids in the eyes and then they cause some damage. So we try as much as possible to get the remnants of the lens inside out. This one also helps as far as healing is concerned, saying that in the next 3 to 4 weeks, the patient should be healed completely postoperatively. As I said, there's a bit of minimal bleeding. You don't need to worry about that. Bleeding will stop on its own. And now, as I said, yes, all the steps are very, very important. And now what Dr. Lopo wants to do is to insert what we call an intraocular lens, which the patient is going to use for the rest of the life, for the rest of her life. So she's gently introducing in the intraocular lens. You can see it there. Normally we do what we call biometry, just to know that the lens that we are inserting into the eye, it corresponds to the right diopter. Because people have different eyeballs, people have different diopters. So we perform what we call an S-scan just to make sure that we get the right power of lens. And normally, once you do a good biometry and do good surgery, cataract surgery, these are patients who might not even require glasses later on because you've had a nice biometry or what we call a nice S-scan. So we make sure that the lens lies inside in the bag, and as we said, it is an inert. It's made of plastic material, and you should be able to stay there for the rest of the life. We don't expect any reaction as far as the lens that we've inserted is concerned. So we don't expect any reaction. The only thing we expect is what we call maybe post-operative, the management saying that we inflammation thereafter. Sometimes the patients become a bit, because of anxiety, we have to keep on positioning them time to time. And I also repeat, the eye is very, very delicate, so we also don't want to rush and do a bad job. We want to do a good job so that the patient can have joy tomorrow. And as our slogan in Loins, we say we serve, and we want to put a smile as far as these patients are concerned later on when we open up the bandage tomorrow morning. So ideally, the surgery is complete. After inserting the intraocular lens, actually we are at the tail end of the surgery. The doctor is just trying to make sure that we stabilize what we call the anterior chamber. Previously, we used to put stitches on the eyes, but because I said because of technology, we moved from that. So it's a sutureless surgery, painless sutureless, and the patients don't need to come back for maybe stitches having to be removed. So those are the last procedure we are performing, so that now we can actually be able to release the patient to go back to the ward to relax, have lunch, as you wait for tomorrow to see how the visual outcome will be. As I said, that's the procedure is over now. We just want to give an injection that will help as far as the healing is concerned post-operatively as we follow up the patient in the clinic. That's why we are giving that antibiotic to prevent any anticipated infection. So up to that level, we'll be able to pad the eye and escort our patient to the ward to be able to have lunch and rest as we wait to be able to check tomorrow morning how the visual outcome will be. So we are done, and we are just want to make sure that we release the patient to the ward. And as I requested earlier, if there are some questions in the audience, we can actually be able to respond to them. Normally, we will check these patients tomorrow morning and be able to give them what we call post-operative instructions on how they are going to use the drops, on how to watch out for maybe signs of danger, saying that if there is anything that is going to compromise vision, we tell them what is required, and we follow them up in the field just to give them more medication and review them and see how they are progressing on. Cataract audit is very, very important as far as these plans are concerned, because we really want to know how well are they seeing once we've done the surgery and we release them to the various areas where they came from. So audit is very, very important just to know how the visual outcome is after the 2 weeks, then after 1 month. If there is any need of maybe giving corrective glasses, that is what we do later on. And then we also use these patients to be able to cancel any other plans that are outside there. There are people who are scared in terms of just having to get cataract surgery done. So there are also ambassadors. When we go to the field, they can actually be able to spread the message and be able to bring us more clients for surgery. So we are done with the procedure, and at this moment, the patient will be taken to the ward for any other further instructions. So I kindly request for any questions, and we are humbled for your patience and watching this video live in our institution. So thank you
Thank
so
you.
much, Lord President, and all the...
Yeah, thank you, Asacha. We will revert to questions. If you have any questions, we will be able to take them and they'll be able to answer them on that side. This procedure, as some of you may know and others may not, is what we call the simple incision cataract surgery, which is the simplest one that we can even do when we're out in the campsites. Otherwise, the other kind of surgery that we do now under topical anesthesia is called the phacoemulsification, but that is done with very expensive equipment, as you know. So this is what this is, which
And
is
we are
simple
also
incision
waving. Yeah?
cataract. Yeah. So if there are any questions, we can speak to them. Would you like to? Asacha, we will be asking some questions and you can respond.
Thank you, thank you.
Yes? Asacha, are you able to respond? Asacha, the question is that when we do topical anesthesia, is the patient essentially awake? And have you ever had a situation where a patient has jumped up because of anxiety?
Yeah, normally, as I said, we do our... Sorry, are you done?
Yes, over to you.
So as I said, normally we do our surgeries under local anesthesia, and most of the patients are actually they are cautious, and they can actually be able to hear us even communicate when during the procedure. But above all, what is more important is counseling as far as these clients are concerned, because we have a team that talks to them prior to admission, and we actually tell them what they anticipate to get as far as the procedure is concerned. So rarely do we have patients who maybe jump out of the bed during the procedure, because counseling is very, very key. You realize that the work for the surgeon is around 5 minutes, but counseling the patients, telling them that we'll have a small injection on the eye, the procedure will take some 7 to 10 minutes, and during that time you are supposed to be still, saying that the surgeon can actually be able to do his or her work, and then after that you can actually be able to take it to the to the ward. You realize that general anesthesia has its own complications in terms of having to make the patient sleep, making them having to recover from the general anesthesia with all the complications, and it takes a lot of time. You can realize that today we're having more than 60 patients to operate. So if you are going to use general anesthesia, we might even end up 2 days operating the number of patients. So local anesthesia in terms of topical or even injectable has proved and has given good results. So long as the patients are counseled well, yes, we might have issues to do with the language barrier, but we try as much as possible to get somebody who can actually be able to understand the language of the clans so that we don't get complications later on in theater. Thank you.
Thank you, Asacha. We have another question. No, thank you so much.
Can you repeat the question because we can't hear you? General manager, you can...
I'm going to relay. Basically, this was a comment. They were really happy with the surgery and they were appreciating the Lions of Kenya and the hospital for doing this great work that we do. And they made a donation for one cataract surgery. So that's what it was. It was a comment and a compliment, if you like.
Thank you, thank you.
Thank you so
We
much.
appreciate, we appreciate.
Yeah, I think if this is it, then I want to thank you all for being here. I'd like to request our district governor and Sudan to say a few words on behalf of the clubs and what they do to support this. And then we shall go ahead and see the patients.
I think we're done.
We're done.
Thank you so much, Director of Ceremonies and General Manager Rizwana. Wow, each day is just getting more exciting and more thrilling. I just can't relate to how wonderful these days of Global Service Week have been. And we have had a tremendous day today, starting with the Sight for Kids program. And that is what the Lion Sight First Eye Hospital do week in, week out. Go to the schools, do the Sight for Kids program, uh, treat some of the students there, give them eyeglasses, and this is a continuous process that the eye hospital does. And today you have witnessed the cataract surgeries, and I would like to most sincerely thank my district governor colleague Daniel Elkins for supporting us and sponsoring the 100 cataract surgeries that are being performed and going to be performed in this Global Service Week. Daniel, for that wonderful gesture. You have transformed the lives of 100 people by giving them sight. And most sincerely thank our Lion Sight First Eye Hospital for putting together this particular activity, for this wonderful showcase that they have done. And you have all been able to see the cataract surgery live. And the Lion Sight First Eye Hospital, congratulations on spearheading this particular program, for celebrating 25 years of service to this great community and this great nation. I was there when this hospital was initiated, and I'm there with you today. And I'm so proud to be part of this wonderful institution. Thank you so much. The Lions of District 411A, and in particular in Kenya, are very much involved with Sight First activities. You saw one of the clubs that was participating in the outreach program is called Nyandarua Greater, which is about 200 miles from Nairobi. And they, whenever the eye hospital goes out for the outreach camps, we contact the Lions Club that is close by, and they send their volunteers come and support in doing these outreach camps, and sometimes even help us transfer or transport the patients to our Lions Eye Hospital. So the Lions of Kenya are very much involved in all this particular program. We have another eye hospital that is in Mombasa, which is about 460 kilometers from Nairobi. We are putting up a mega eye hospital in Kisumu, which is going to serve the western part of this country. So as far as the outreach is concerned, we will be in the next couple of years be able to cover the entire country of Kenya, and our Lions will continue supporting. So thank you so much, Daniel, and your team for being here, and we truly appreciate your support to us. Thank you. God bless you all. Ladies and gentlemen, let's go and see live the 100 cataract surgeries and the journey of 100 cataract surgeries and meet the patients themselves.